Today let me show you how we apply vacuum assisted closure for wound healing. You can see here in the video, after tracing the wound, we apply an adhesive thin film over the wound. As you can see here, this is to create a seal environment. Now we put a nick over the wound with a surgical plate. So you can see here, this patient underwent thoracotomy for decortication, and at one place at the medial edge of the wound, it got infected, so we have to do dressing and it was not healing, so we plan to apply this vacuum assisted closure. So now after this, we pack the wound with a foam or polyurethane foam or a gauze dressing. So here we are using a polyurethane foam. As you can see here, we are packing the wound so that through this we can apply that vacuum suction dressing. After this, now after packing the wound, we again apply another adhesive film, the same material over this, so as to create, like I said, to create a seal environment. As you can see here, this dressing is very important in cases of chronic wound that is not healing. And now again we are putting a nick using a surgical plate over the adhesive film, on the adhesive film over the foam dressing, over the foam, and now after that we are applying this suction. You can see here, and this is negative. This suction dressing is connected to the vacuum pump. This is the vacuum pump with a drainage tube. This tube, you can see this, that we call drainage tube. These drainage tubes connect the suction to the vacuum pump, and we usually keep the pressure. See, you can see how it is connected. This is how it is done. And now the pressure we usually keep minus 50 to minus 125 mm mercury to safely extract fluids and through the wound edges. Now we'll keep the pressure at around 125, minus 125. This is sub-atmospheric pressure here. And now after this, now we apply a normal dressing over it. So this is very important. Why this is very important? Because it reduces swelling, it drains excess fluid or pus, and it also lowers the bacterial level of the wound, and this will stimulate new tissue growth by continuously or intermittently deforming the cells in the wound bed. So this vacuum VAC is also called negative pressure wound therapy, as we and this is the repetition of the video that I am showing so that you can learn. And we usually use this for diabetic foot ulcers, pressure sores, and large surgicals and traumatic wounds, and also skin graft and skin flaps, helping them to adhere and vascularize, and also wounds with heavy drainage or swelling. And this you should avoid in where there is untreated osteomyelitis, bone infection, necrotic tissue, or bone that have exposed blood vessels, organs, or nerves, and also active uncontrolled bleeding and patient on heavy blood thinners. You should avoid this vacuum assisted closure. This is very important. So now you have learned how to apply vacuum assisted closure for wound healing. Like I said, this will accelerate the wound healing. So thank you for watching. You can uh, watch the video again till the end. So how it is done, this is very very good in chronic wound that is not healing with a normal dressing. Through our experience we have learned that it is very useful for chronic wounds that is not healing fast. So by applying this, it speed up the healing of all types of wounds, acute, subacute, or chronic. Large chronic wound takes up 16 to 20 weeks of wound to completely heal sometimes. So thank you for watching once again. Oh, thank you.